Usually in the literature, I think there is usually variation of 0.5 diopters. But in the Uma's case, I think there was none. Right. Now please start. Next.
Good morning, everyone. My topic for presentation is comparative analysis of Femtis Mplus versus the panoptic storic multifocal IOL. So modern cataract surgery has evolved into a refractive procedure with the advent of intraocular lenses like the multifocal intraocular lenses, which promote spectacle independence by providing good vision at all distances. One of such lenses is the trifocal intraocular lens, which compared to bifocal IOLs, they improve the intermediate vision by providing a third focus. The Femtis Mplus is one such IOL which is designed for capsulotomy fixation, and it provides smooth distance from distance to near based on its asymmetric refractive optics with varifocal technology. A second such variant is the panoptic storic IOL, which is designed for in-the-bag IOL implantation. It has a unique diffractive structure which allows high light utilization. The aim of the study is to analyze and compare the clinical outcomes and rotational stability of these two presbyopia correcting toric intraocular lenses. So it was a prospective, randomized, comparative, two-arm, single-center, single-surgeon study with 60 patients in each group, and 3-month follow-up data was available. These were the inclusion and the exclusion criteria. So complete preoperative ocular examination was carried out, followed by which all patients underwent femtosecond laser-assisted cataract surgery. The Femtis Mplus IOL was implanted with anterior capsular fixation, while the panoptics IOL was implanted in the capsular bag. Both the lenses were positioned at the desired axis using the IntelliAxis technology by the Lensier, which creates two nubs on the capsulotomy margin. This is an image of the capsular axis nubs. Post-operative follow-up was done at day 1, 1 week, 1 month, and 3 months. Coming to the results, so uncorrected distance visual acuity was significantly better in the Femtis group as compared to the panoptics group. However, at post-operative 3 months, the uncorrected distance visual acuity was found to be comparative in both the groups. The mean manifest spherical equivalent was found to be significantly better in the Femtis group as compared to the panoptics group. 100% of patients in the Femtis group had a manifest spherical equivalent of plus minus 0.5 diopters as compared to 98.3% in the panoptics group. Refractive astigmatism was found to be better in the Femtis group, with 88.5% patients achieving a refractive astigmatism of less than 0.25 diopters as compared to 76.7% patients in the panoptics group post-operatively. Uncorrected near visual acuity was found to be comparable and good in both the groups, while the intermediate vision was found to be slightly better in the panoptics IOL, but this was not statistically significant. Rotational stability was found to be significantly better in the Femtis M group. One patient in the panoptics group had an IOL rotation of more than 10 degrees as compared to none of the patients having IOL rotation of more than 5 degrees in the Femtis group. The defocus curve showed good and comparable visual acuity at all defocus points in both the groups. Contrast sensitivity was found to be significantly better in the Femtis group at all spatial frequencies. Dysphotopsia questionnaire and patient satisfaction scores were found that a higher percentage of patients reported of glare and day and night halos in the panoptics group as compared to the Femtis group. And vision satisfaction score at post-op 3 months showed that the Femtis Mplus group scored slightly better, significantly better in terms of night vision, while the panoptics group scored slightly better in terms of intermediate vision. So in conclusion, both the IOLs, they deliver excellent uncorrected and distance vision. The panoptics toric IOL, it has an edge as it provides superior intermediate vision, and this is because it incorporates an intermediate focal point of 60 centimeter, while the Femtis Mplus IOL offers better rotational stability and lesser dysphotopsia. This is attributed to its unique clip haptic design and smooth transmedial surface transition. And a higher percentage of Femtis Mplus patients achieve post-operative astigmatism within plus minus 0.25 diopters. So personalized patient selection remains the key to optimizing visual outcomes and overall satisfaction. This is a picture of the Femtis Mplus IOL. And this is a video which shows the implantation of the Femtis Mplus IOL with its clip haptic design onto the anterior capsulotomy margin. So it has 4 clip haptics, 2 on the longitudinal side and 2 on the latitudinal side, with the help of which it is attached to the anterior capsulotomy margin, which is made with the help of a femtosecond laser. Thank you.
Excellent. Do you use, which femtosecond laser do you use in all these cases?
So we have two, sir, but we have LENSER and we also have the Zymer, but we prefer the LENSER because it gives us the two capsular axis nubs.
Absolutely. So you have both the elements there, the
Yes,
right
sir.
kind of marking, at the same time fixation is good
Fixation
and
is
it
good.
doesn't descend.
Yes, sir.
Excellent, excellent.
Thank you, sir.
And Dr. Taneja,
Yes.
Mukesh Taneja, would you like to add something?
Sir, did you find any complication in this Femtis?
Femtis, a few patients had come with difficulties in intermediate vision, which was seen in the post-operative 2 weeks, but that stabilized over post-op 3 months, sir.
After 3 months?
It stabilized. Because we followed them up after 3 months, it stabilized, but they reported that within 1 month they were more comfortable with the Femtis.
Okay.